Okay, so you've just had the Femina procedure. So what we've done is we've used a laser procedure to tighten the vagina to stop the urinary incontinence or you wetting yourself when you're coughing or running or uncontrollably, or to make sex more comfortable, or you've had a baby and it's not as tight as we'd like it. So what we've done is we've provided a laser technique to shrink and get the mucous membrane in the vagina to start producing the tissues and juices we need to tighten the vagina, stop the urine from leaking out, but also to make sex more comfortable. So what we ask you to do is, before we even do this procedure, either myself or one of my other doctors have done an internal examination to make sure that you can have this procedure. They've taken a gynecological history as well, and then they've said you're allowed to have this procedure or you're not. The aftercare for this procedure is no sex for the next 48 hours. That's the first thing. The next thing is you may get a little bit of spotting or bleeding. That could be normal. If it's heavy like a period, that is not normal. Okay, so we also time the procedure depending on your cycle of the month. The other thing is, when you pass urine, it might be a little bit stingy. Your skin cells in the mucous membrane, i.e. in the layer of the vagina, are just rehealing themselves, are just resetting and getting ready to tighten up. So there's nothing else to worry about. You might notice a little bit of clear or pinkish discharge. For the next 7 days, that's quite normal as well. The other treatment you might have had is a little bit of contouring in the labial folds of the vagina to actually bring the mouth, the opening of the vagina together. So it will be swollen for the next 48 hours. It's exactly like contouring work on your face. It will be a little bit swollen. It won't be painful. You won't find bruising, but it will be a little bit swollen and it will settle. Again, avoid sex. It'll be a little bit uncomfortable for the next 48 hours. If we've noticed some pigmentation in the groin or the vaginal area, we might have put you on a skin program to lighten the area up as well. Again, in this area, your aesthetic lead will tell you how to use the product sparingly to lighten this area. It will become a little bit red and itchy initially, but as your skin develops tolerance, you'll notice that it will lighten quite easily, and within a few weeks, you'll be happy with the result. Any questions you have, any concerns you have, always contact the LMS concierge team or contact your aesthetic lead, and we can answer them for you.